This cold and flu season already packing quite the punch. Recent data from Public Health Ontario reporting high numbers of both walking pneumonia and whooping cough. The Provincial Health Agency in its latest report said the number of whooping cough cases in Ontario this year between January and November reached a level that hasn't been seen in 17 years. When it comes to walking pneumonia, Public Health reporting the highest number of cases since it began tracking the data in 2019. So lots to unpack, but there is some good news to share. Joining me now is Dr. Jeffrey Pernica. He's a pediatric infectious disease physician at McMaster Children's Hospital in Hamilton. Thanks for being here with us.
Thanks so much for having me.
We'll touch on whooping cough in a moment, but we actually want to start with RSV. This is something you've been watching closely. What are you seeing so far this season?
Thank you so much for asking about that. RSV has always been the most important pathogen, the most important germ affecting young children, and is one of the primary drivers of hospitalization, especially in the winter season. Thankfully, this year, the RSV season is starting a little bit slower, but it is going now. So we are seeing mounting numbers of cases, both in McMaster Children's Hospital and across the province of Ontario. I'm glad you asked me about that, because this year, for the first time ever, all of the infants born in Ontario have access to a new prevention product to reduce the risk of RSV disease. I should have said that all infants born in 2024 and who are going to be less than a year when they get it are eligible for nirsevimab, this new product that is available to prevent against RSV infection.
We also want to switch gears and talk about whooping cough, because we mentioned some of that data from Public Health Ontario and the numbers being up. But you and I were chatting earlier, and you said cases in your region are starting to ease. But this is another one that can hit kids particularly hard, and it is preventable.
Yeah, no, it is good to highlight that the Public Health Ontario report reveals that the case numbers of whooping cough peaked in the summer. But exactly as you say, the age group most at risk from whooping cough is really the young infants. Older children and adults can absolutely have respiratory symptoms and prolonged cough. They used to call it the 100-day cough, but young infants can die from pertussis, right? And so it's really critically important that pregnant people get the whooping cough vaccine in the 3rd trimester of pregnancy. This enables them to pass on important antibodies to the fetus, which will prevent them from getting severe pertussis disease in early infancy.
Dr. Pernica, we're almost out of time, but we are heading into holiday season. I'm thinking of concerts at schools, family get-togethers. Any advice for people as they're heading out in group settings over the holidays?
Yeah, I hope that everybody has a great holiday season. I mean, this year I would recommend what doctors have recommended every year, right? Wash your hands before you eat or after blowing your nose. Anybody who feels unwell, fever and respiratory symptoms, please don't go to holiday gatherings or work or school for the few days that we have left. And really, just do your best to keep the most vulnerable among us, right? The young infants, those people who are immune compromised, elderly adults, away from people who have obvious respiratory symptoms.
Really good reminders this time of year. Thank you so much for joining us. We really appreciate your insight.
Thank you so much for having me.
That's Dr. Jeffrey Pernica. He's a pediatric infectious disease physician at McMaster Children's Hospital in Hamilton.